Welcome to the Afterspin, opinions from thought leaders in our state. I want to ask Chris Fitzsimon and John Hood. CMS, the Center for Medicare and Medicaid Services in Washington, has granted the waivers North Carolina requested in order to change our Medicaid plan to a capitation or managed care plan. Care provider groups and insurance companies have already submitted their bids to win contracts to manage our Medicaid program. What are you looking at to determine how well this new approach is going to work, John?
Well, there are two factors in my mind. One of them is that, remember, this had been a very contentious political debate for years. I actually think that is not entirely but largely subsided. Both the Republican-led General Assembly and the Cooper administration are bought into this. They may have slightly different views, but not radically different views about what they hope it will be like. So the politics of this, I think, is settled down. But here's what the other factor is: expectations. I think people who advocate this policy may have unrealistic expectations about its effects on Medicaid spending over time or Medicaid quality over time. I think there's a good argument to be made that it will be a better system, but people need to be careful in ratcheting their expectations down to a realistic level.
I think the healthcare community balked at this a lot, but I think they have finally bought in also. I think it's an inevitability thing with them. Well, Chris, what's your take on this?
I don't disagree with that. I do think there are people that think this is going to be immediately a massive savings, and the goal isn't to massively save money, it's to provide better health care. We don't want to waste money, but that's, I think, the goal going in. The second thing is we are, I think, lucky to have Mandy Cohen as HHS Secretary, who has experience with running Medicaid in Washington and has managed, I think, to bridge a lot of political and ideological gaps in North Carolina as we transition to this. And then, I know we don't want to talk about this, but looming in the shadows here is there are still states talking about Medicaid expansion. There are a couple states around the country, Republican states, Idaho, for example, that have that on the ballot this November. So I think that issue, while we think it's gone away in North Carolina, there's still Republicans in the legislature, a couple who have medical backgrounds or hospital backgrounds, who still think we need to head in that direction once we get this done. So it's going to be fascinating as Medicaid evolves in North Carolina.
And we're supposed to be kicking off this new managed care system in February of next year. So obviously we're going to be talking quite a bit about it between now and then. Well, thank you for watching the Afterspin. We'll have more video all during the week on ncspin.com.